As always, it is 11:15, which means it's time for our startup story. And Toonie is really excited about this startup story because it is one of her favorite startups that came out of Brown over the last couple of years now. It is ResusciTech, and we're going to hear from co-founder and CEO Abigail Kohler, who will be interviewed by Brian Morley of EmergeWorks. So Abby, if you want to take it away.
Thank you everyone for watching today and for listening to me talk. So I'm Abby Kohler. I'm the co-founder and CEO of ResusciTech, a med tech company that's empowering people and training people to take action during medical emergencies, particularly when they need to perform CPR if someone has a cardiac arrest. So if you have a cardiac arrest, the quality of the CPR you receive is the single most important factor in determining your chances of survival. And cardiac arrests are abundant and they affect people of all ages and all health levels, all fitness levels. They're actually the #1 cause of death in student athletes. So cardiac arrests impacts a lot of people. There are 350,000 out-of-hospital cardiac arrests annually, and they're 90% fatal. So it's a big problem and a lot of people die because of it. And the CPR training classes that traditionally happen don't reflect the urgency and importance of performing CPR. CPR training classes are really boring. You essentially watch someone repeat a predetermined script for 4 to 6 hours, and it's really expensive, and you maybe get 5 minutes of hands-on practice with a mannequin. And this problem is exacerbated for enterprise, where there are more than 40 million Americans who have CPR training requirements for work. So to address this, we've created an app called Smart Certification that allows people to get CPR trained in a fun and engaging way right from their smartphone. So you don't have to go to a class in some random building somewhere in your city or town. You can do it from anywhere. And we enable people to do this with a software that we developed that allows you to just hold your phone like this in CPR position and then start performing chest compressions, and you get feedback on the depth and rate of your chest compressions. So you know that you're doing them correctly. It's essentially like having a CPR trainer right in your pocket that you can use at any time. And we've created a really fun and engaging way to learn about CPR and AED use. So to date, we've participated in 4 accelerators. We've received more than $140,000 in non-dilutive grant funding. We filed 3 provisional patents and 1 PCT filing to protect our IP. We launched our app this past March after months and months and months of beta testing. And we have already formed 2 strategic partnerships in order to help spread this app to the people who need it the most. Our 2 strategic partnerships are both in the fitness industry, and we're getting this out to certified personal trainers and yoga teachers as we speak. Our team has grown to 5 people total, and we're all really excited to bring to the world a technology that gives people the confidence and the capability to perform CPR in emergencies. So I'll turn it over to Brian for the questions.
Well, thanks, Abby, and great summary. And yeah, I've been, when I came into this ecosystem about a year ago, 14 months ago, the ResusciTech team, I think it was right before COVID. I think you guys were doing some beta. You were going to do a beta testing like the week before the world, or the week after the world, that weekend after the world shut down. I know Nemec was trying to get some folks beta testing, and just the amount of progress that you all have made through COVID, and now that it's out, and strategic partnerships with national companies, it's just amazing the amount of progress that the team has made. So, so kudos to you and Greg and Aaron. So first thing, I'd like to understand, and maybe I think it would be great for the audience to hear, is when you started this company, what was the inspiration behind this? You and Greg Fine, I know, started the company, but what was the inspiration? What was kind of the initial mission of ResusciTech or vision? And then how has it evolved or transformed over the 2 years, 24 months, or however long it's been since the initial inception?
Yeah, so Greg and I started this company because we were both really in love with entrepreneurship as a concept. We really loved entrepreneurship as a methodology for problem solving, particularly as people who were studying engineering at the time. it was just a new and really good way to approach problems for us. We had both been a part of startups before, but really wanted to start something of our own. So we were already like keeping an eye out for problems to address. And then I was shadowing in Rhode Island Hospital because I was taking a medical illustration class, strangely enough. I really love art. So I was, really happy taking medical illustration. And I overheard an EMT talk about how difficult it was to do CPR. And I thought, wow, that's really crazy. They're an EMT. If anyone should know, it should be an EMT. And sure enough, people who do this, more than anyone else still find CPR really difficult. So that was the sort of spark right there. I said, there seems like there could be an engineering solution for that. I think we can address this.
I love the fact that you started with a problem and not a solution. I find there's so many folks that have solutions and they're just trying to find the problem that it solves. And it's that square peg, a round hole situation. So I love the fact that you started with a problem and then said, okay, what kind of talents and skills do we have to create a solution? So sorry to interrupt, but I think that's important for the audience to understand.
Yeah, we definitely started with a problem and we had some initial assumptions about what the solution might be, but that changed so drastically, particularly in the first couple of months as we were doing more research and talking to doctors and nurses and really anyone we could find. And then, as you mentioned, our entire business shifted due to COVID. So initially, we were planning on creating a hardware device. Then we switched to software and we were developing an app with the intention that the app would be used on real people during actual emergencies. And then we had planned out our first usability study to collect data that would eventually go in our 510(k) application to the FDA. And that study was planned for March 14th of 2020. So that did not happen for obvious reasons. That was, I think, the first weekend that the whole world was effectively shut down. So that study didn't occur. And we ended up, being faced with a situation where we had to pivot pretty quickly. And we realized we'd created the perfect thing for CPR training to enable remote CPR training. So that's what we switched to. And it's been great since then. And we still plan to resume those studies at some point because we do want to create something that can be used in real emergencies. When someone's having a cardiac arrest, you can pull your phone out of your pocket and get rate and depth feedback and perform great compressions right away. But that's now moved further down the line as we address CPR training.
And I know you mentioned pivot, but I mean, I really don't think you pivoted because you built a foundation of technology and you're still looking at the problem that you're solving. So that didn't change, right? When I look at pivots, it's like, uh-oh, I'm stuck. I got to turn. Like in basketball, when you stop your dribble, it's because you're in trouble. You weren't in trouble. You just kind of adjusted your approach, and you're still gonna ideally still meet the goal that you set out for. So that's impressive that you guys are able to continue down the path, right? And that the vision hasn't changed, and that you can still progress to that. So progress today, I know you touched upon it. So help us understand kind of where you were thinking, where your head was at a year ago when you decided, okay, CPR training it is. Now what? And kind of how you got there from, okay, we're going CPR training, and then what channels do we go down? Who are the people that we want to start with? How did you kind of get to where you got to, and what was that process like?
Yeah, so we had investigated CPR training as a potential market before COVID, thankfully, which meant we had a lot of the initial research and customer discovery already complete in order to just jump into it. So the first thing we did, quite literally, was start to build the app. We already had the feedback portion working, but we needed the entire course. We needed the entire training component. So I dove into research. I'm the kind of strange person who really loves regulatory burden and regulatory barriers. I love reading through that kind of stuff. So it was the perfect task for me. And we started creating the course content and creating the app. pretty much right away. And then, testing our initial video content with people, and then realizing we needed to do something more engaging than just videos. We needed fun and entertaining and interesting questions and learning activities for people to complete, so that it would actually be a fun course that you would truly learn from, rather than just kind of watching a lecture, like the standard model. So we started building that and iterating upon it and improving it. And that's really all that was happening until about October of last year, when we started beta testing really earnestly. We beta tested 3 different versions, some of which you helped us out with, Brian, particularly introducing the demo mode and other parts of the app. And then we launched it to the public in March. And since then, it's been trying to get it in people's hands.
So the reception so far, I think you touched on it, glanced over it just there, where it was, you've built this hands-on component, which was the true kind of secret sauce of your technology. But then you realized that there was another component, the didactic piece of the education piece, that was probably maybe lacking, but then you've built that up. And now that actually has an interesting component, because now it's gamified and it's, different, novel. So now you kind of have this 1-2 punch. How has that been received by some of the channel partners that you're discussing, and what are some of the pain points that you feel like these 2 components are addressing, and how is it being received on the marketplace?
Yeah, so far, overall, it's been perceived very warmly. People really like that it is shorter, more engaging, more entertaining, more fun. People feel like, despite the fact that there's not an actual person teaching you, people have felt like this experience is a lot more personal than a CPR training class, where the trainer is barely watching you with your 5 minutes on practicing on the mannequin. It's the data and the feedback you're getting is personalized to you. So people have felt like that's a much better overall experience. And then as far as the learning activities go, people have really enjoyed that over a traditional lecture style. We gave a bunch of our users a survey, and a lot of them felt like they would retain information much better than and much more easily than a traditional CPR training course. So the response has been really warm and quite exciting.
That's great. I think you're creating value on the marketplace, and I think one of the things that I've noticed is this technology has the ability to turn a pain point. CPR training has been it's like doing your taxes, right? And you've turned it from a pain point to a possible positive experience. So I think that's a huge, and it's such a simple and innovative way to do it, to turn something that's painful into something that's people look forward to doing is an amazing thing to do. So I know we don't have a ton of time, but let's talk about where we're at. We're in Rhode Island. We're in this innovation center of Southern New England, this hub that's starting up. Tell us about how the Rhode Island community, this innovation community, has supported you, guided you, and how do you think they've helped?
Yeah, so we started developing this while Greg and I were students at Brown. So we got a lot of support from Brown and from the Nelson Center for Entrepreneurship. And then, when we graduated, we continued to get support because there are just so many resources here. I'm currently sitting in NEMIC's office, and there's the CIC, and there's RIHUB, and of course Venture Café, and like so many resources. I like to tell people that there are more resources in Rhode Island than there are entrepreneurs to take advantage of them. There's just so much here for people. So that's been really, really fantastic for us. And that's the reason, we've stuck around, and we'll continue to stick around. I don't see us ever leaving Rhode Island because we've gotten so much support here. There's no reason we would want to leave. And of course, there's so much talent in this area too. Brian, we found you here. So we're quite happy to be here and stick around.
Yeah, I'm only about a year into this experience as well, but I found that the talent, the different skill sets and the talent is is very high and very accessible here. And that's why I wanted to be a part of this, because you're only 1 or 2 phone calls away from someone that has the experience or the know-how to help you solve the problem that's in front of you. And if they don't have it, they're one person away. So that's what I love about where we live, and because of this talent, and being part of the New England med tech community, it's having that access to everybody is amazing too. So maybe I think I can open it up to questions from the crowd if anyone has any questions. But this was a phenomenal story. I'm glad that I'm a small part of it, and there's so many people that are on this call that are all part of it, and we're excited to be beside you and behind you and watch this company grow and succeed. So I'll open it up to questions.
Brian, you're being too modest. He's our chief marketing officer for people who don't know. So he's a much bigger part than he's making himself out to be.
All right. Abigail, there was a question in the chat about corporate partnerships, and Diana answered. Do you want to expand on that? Diana said that you have a few corporate partnerships already and more in the works. And
yeah, happy to expand. Thanks, Diana, for having my back on that one. Yeah, we have 2 corporate partnerships right now. They're both in the fitness space, although we're looking to expand outside of fitness as well. Our current corporate partnerships are with 2 national companies. One is Yoga Alliance and one is Fitness Mentors. And they're both helping us reach their customers across the personal training and yoga training space. All trainers in the fitness industry need to know CPR because exercise, very arduous exercise, increases someone's risk for having a cardiac arrest. So we've been targeting those people because they've been really, really receptive to this technology so far. And we are in the works of some other really exciting corporate partners that hopefully, if you follow us on LinkedIn or other socials, you'll hear more about soon.
Awesome. I did drop your LinkedIn for the company, but Brian and Abby, if you want to, if you're comfortable, you can drop your LinkedIn for your personal selves. He has a quick question and then we'll move on.
Well, I'm one of your biggest fans and one of Diana's biggest fans with her company. What can we do locally to help you?
Yeah, so I think the first thing is just our app is free to download and free to go through the whole training. And then, we have a cost for the certification, but all the training itself is free if you don't need to be certified. So the first thing is just get yourself CPR trained. Everyone should be CPR trained. You never know when an emergency might happen. They happen all the time. We all hope it doesn't happen around us, but it might. So be prepared for yourself and for your family and for the community at large. It's great to be prepared to handle an emergency. That's thing number 1, just from, let's all be good, supportive citizens standpoint. And then beyond that, we're going to be doing more user testing in the near future. So if anybody's interested in trying some of the newest screens of the app that we're going to be releasing soon, we would love some beta testers and some more users. If anybody's interested, it would involve a short Zoom call with us. But that's most of it at this point.
Awesome. I have to say, my brother is a PA, a physician's assistant, basically almost like a doctor. And my sister-in-law is a CRNA, and, big, I always pronounce it wrong, but that is a nurse anesthetist. So she puts people to sleep. She's like an anesthesiologist, and randomly, and then one of my other brothers is, in medical. They've all experienced random people having, cardiac arrest, like at a restaurant in line for brunch. Joey had to give someone CPR. So it does affect anyone, and you don't know when it's going to happen. So that is one of the reasons I'm such a big fan of ResusciTech. And I love that Brian joined our community and is involved in this company, because it's just going to be fun to watch you continue to grow. And I second what Brian said. Wow, you have really, I was there, right? I was one of the judges at that We at Brown pitch, and that was my last in-person event. And you've you've accomplished so much through the pandemic. So yay.
Thank you.
I have two other questions. You said, how can we help? So I'd say one thing that's big into the mission is community outreach, right? So if you feel like that there's communities that you're plugged into, especially underserved communities, that you feel like you can make that might need this technology, we want to have that conversation and we want to help. So please connect us with people that you think could need this and would be receptive to it, is one. Number two is, within CIC, right? And Venture Café, who's CPR trained? Let us help, right? So plug us in. If Rhode Island wants to support, if we really want to support each other, let's support each other, right? Let's knock the walls down and let's help each other out. So whether it's connecting us with large organizations like CVS and Hasbro, or just connecting it, having us be the preferred CPR provider for CIC Providence. Let's make it happen.